Hello everyone, and thank you for attending our webinar today. My name is Rich Flaherty and I'm the VP of Sales for MDeverywhere, and our topic is the consumerization of healthcare. So what are we talking about when we say consumerization of healthcare or patient consumerism? What we're talking about is the fact that the healthcare market is changing. With the advent of the high deductible health plans, cost-sharing models, health insurance exchanges, more of the responsibility for not only the cost of healthcare but also the choice of choosing a healthcare provider is falling onto the patient. No longer are patients just going down the street to the local practice and getting their healthcare from that local practice. They're looking for the practice that best fits their needs. Since they're paying more for it, they're having to put more effort into the process. They want to make sure they're getting the most out of their dollars, and they're looking for practices that are going to differentiate themselves and really optimize that patient experience such that the patient is feeling like it's the best place for them and the place that meets their needs the most. And that's the change that we're going through. So for practices, what that means is we have to react. We have to change away from the traditional ways that we interact with patients and bring a much higher level of patient satisfaction in that patient engagement process to the table to differentiate ourselves against those other practices that patient is looking at, with the hope that that patient's going to come to our practice. And how do we do that? The key thing here is using established interactive tools to engage with your patients, both reducing their time investment that they're making, which is going to improve their satisfaction, but in the process actually potentially reducing your office time investment and costs for your office in order to be able to acquire those patients. Things like 24-hour scheduling through the web or through the phone, utilizing email for communications with patients, from the MD via email. So in other words, information being sent out to them via email with information about health concerns or topical articles and such. Communication preferences around reminders, not just living in the world of making personal calls out to patients or even utilizing the traditional automated telephone calling mechanism, but expanding out the reminder notifications around texts and emails, offering other ways for patients to make payments besides writing a check and sending it to the mail with their statement, online bill pay, automated payment plans, ability to make payments over the phone. All those are tools that are out there in the market today that most practices aren't taking advantage fully of, that are going to be the things that in this new world of patient consumerism that are going to differentiate your practice compared to the other practices that the patient's looking at, and hopefully bring that patient to your practice. So let's talk about a few of these. First one is online appointment scheduling. So again, traditionally, the way that patients set appointments was they would call the office when the office was open. So what does that mean? That means that the patient really has 5 to 6 hours a day on average to be able to place an appointment in the middle of the day when most are working, and they're having to take time out of their work day to call and schedule appointments. And unfortunately, a lot of times sit on hold to be able to get that appointment scheduled. If you think about it from a standpoint of your office investment, if you figure that a typical doc sees on average about 32 patients a day, so for a single doc office alone, if you figure 4 minutes per call to schedule an appointment, that means that someone in your office is spending 2 hours a day just setting appointments. So not only is it inconvenient for the patient, but it's very costly for your office. So we need to get away from having that be the only process for a patient to be able to make an appointment. And again, the practices that move in the new direction are going to be the ones that are going to get those patients who are out there shopping. So things like online appointment scheduling through a web-based model. It's available 24/7. They can do it when it's convenient. The patient can do it when it's convenient for them. It certainly reduces their time, but it also reduces your resources time on your side and the costs on your side from having to have people answer the phone. Plus, it can take away a lot of the phone calls that are coming to your office hence making your office phone line more available for patients when they do call with other issues, whether they talk to a nurse, whether they have a question about an appointment, whatever it is. Those patients are also not having to wait on hold as long because you're relieving the phone lines from all these phone calls having to be made because of appointments. It also allows you to capture more information in a more structured process of the patient information, whether it's insurance, whether it's all different types of data that you could potentially capture from them. It also allows for the patient to take ownership of the process. So therefore, they feel like they're in control. They can pick the time that best fits them going forward. And lastly, it can be a great way to drive patients to your website, so you can utilize your website as a selling tool and a communication tool with your patients. So now that we've got them scheduled, the key next step is how do we keep them? How do we keep those appointments from not being no-shows? Typically, MGMA says that most practices see about a 5 to 7% no-show rate during a day. So think about that, what 5 to 7% means. If you've got a single doc office seeing 32 patients a day, that means that anywhere right around 2 appointments a day are no-shows. What does that mean for the practice? One, obviously that's lost revenue because that's time that's not being, not driving revenue. Number two, and a lot of practices are in this mode where they see new patients or when they have new patients who want to sign up. It can take anywhere between a month and 2 months potentially for that patient to get a new appointment. Well, if you're losing 2 appointments a day, which is 9 to 10 appointments a week of no-shows, that's time that's being eaten up, spots that are being eaten up that could be used for these new patients and allow that time period to be shortened up. So 5 to 7% it means a lot to the practice, in a negative way, and so we need to figure out how do we eliminate those no-shows. Obviously one is to create interactive tools for patient reminders. So we talked about that on the first slide. Don't leverage the traditional model of having folks in the office make phone calls out, or that automated phone call process that is available, that's been available for a while that many practices utilize. Look for tools that allow you to send reminder emails, reminder texts. Make sure that you're leveraging the ability to have other ways to be able to communicate with the patient to remind them of appointments so you lessen the no-shows. And then also, as we talked about, utilizing the online appointment scheduling. When those patients are online and they set their appointments, give them the ability to click on a link that would then update their personal calendar. So whether they use Google or Gmail or whatever it is for their personal calendar, give them the opportunity to update their personal calendar so that way it's on their calendar. Don't just assume that they're going to write it in their calendar. The days of writing in the calendar or giving, them carrying around that appointment card and having it on their refrigerator are going away. We need to make sure, again, that we're giving them as much information and tools to be able to interact as possible. The next side is patient responsibility. And again, this goes back to patient consumerism, because the worst thing that can happen is a patient getting a bill in the mail, a statement in the mail, and finding out at that point that they owe $500 because of $500 deductible. It breeds dissatisfaction with that patient. So we need to be able to help the patients to understand their patient responsibility up front. And that, different ways to do that is, create tools that allow patients to estimate the cost of the services for the services they're going to be getting that day at the appointment. And help them to understand what their payment obligation is and what their particular situation is with regards to their insurance. If you have a patient that comes in and you want to make sure you run that eligibility insurance ahead of time, so you're prepared to have the conversation with the patient about the fact that they have a high deductible plan, and that if they haven't met any of that at this point, so therefore they're going to be paying for the majority of the appointment that they have with you today, and make sure they understand that's their obligation to pay and what those payment terms are and the timing that you guys expect them to be able to make those payments. It's important to, in the satisfaction of those patients to be as upfront as possible so there's no surprises on the back end that's going to breed dissatisfaction. And then obviously when we do have to send out that statement to them with the balance that they owe, we need to make sure that they understand it. And this is where the term patient-friendly statements has been bandied around for years. There seemed like there was a big driving force about 5 to 7 years ago to actually come out with some standards. Unfortunately, as we all know, nothing really developed in that patient-friendly statement, so we can't expect that it's going to be any standards out there. So the key thing here is we need to do this on our own. We need to make sure that we're giving a statement to a patient that is very friendly, that is something where they understand what the statement is telling them, and inherently that will then, one, limit the amount of phone calls that the practice has to take to answer questions, and two, enhance the opportunity that the patients are going to make payments more quickly. So we're talking about this. There's some key areas. Make it clear and bold. Make sure your logo is on the statement so there's no confusion that that statement is from your practice. They will remember your practice. Many patients get statements that aren't very clear, and they won't react to them because they think they're spammy or spam mail. Use legible fonts. Make sure that you're highlighting the areas that are of importance, the statement sections, the account, the guarantor, the amount due, the due date, the remittance address. All those need to be bold and very legible and clear, in addition to the fact that we're dealing with elderly patients in a lot of cases who need an easy-to-read statement. Make sure the statement's clear and concise and correct. We don't put additional data in there that doesn't need to be there, because that inherently lends itself to confusion and questions and such. Make sure that's very clear, showing exactly what you want the patient to see. And then lastly, you look at different mechanisms to be able to deliver that. Don't just rely on the traditional U.S. Postal Service process of printing, stuffing, stamping, and mailing a statement out. There are other ways to do it with online statements, e-statement notices that you can take advantage of that actually, in a lot of ways, and with a lot of the studies that are out there, have improved responses from patients, because they typically will view their statement, and if there's a link there where they can click on it to then go and make a payment, they will do that, as opposed to going and getting a check, filling out the check, getting an envelope, finding a stamp, and getting it in the mail. They're reacting to those online mechanisms, and so many people are paying online with their bills nowadays, and the process is becoming more accepted and more used. But the other side of it for you as a practice is it's a lot less expensive, whether you're doing it on your own or if you're doing it through a clearinghouse or a vendor to send your statements. It's a lot less expensive for you to send out an electronic statement and have statements online, as opposed to paying the cost to have that printed statement mailed to them. And then obviously that you mentioned a little bit that online bill payment. So again, this is a new world, and many practices have not taken advantage of this yet. Patients will make payments more quickly, and are more apt to make a payment more quickly if they have an online process to do that. Even the elderly patients, if you have an elderly population, there was a study done by a clearinghouse a few years ago where they looked at the online bill payments that were being processed for patients, and the average age of the patient making a payment was 50, and this was years ago, so it's probably even higher now. If the average age is 50, that means that there's a lot of patients who are much older who are also making payments online. So we can't go off the fact that the elderly patients won't react to online payments. They want that, they want to make payments through the mail. That this is a technology that's there. You can have them be credit card only. My suggestion would be look for solutions that offer both credit card and check functionality. It also make sure you're looking for ones that do automated payment plans via credit card and check. But make sure you're giving them the easy way to make a payment, and don't rely on them to do this check and stamp method. It just eliminates payment procrastination. One of the big advantages for you is that you will do away with bounce checks, because if they make a payment online with the check, the funds are verified then, as opposed to you getting the check in the mail and finding that check bounces later on. Obviously, it saves you some costs because you're not processing those payments that are coming back in for deposits. And then, again, as I mentioned, it eliminates late fees and overdrafts, which is certainly saves the practice money. The next area of the consumerization side deals with finding those patients and growing your volume. Very few practices out there are 100% full. They can't take any more patients. And so obviously in this new world, you want, with the whole consumerization of healthcare and patient consumerization, in growing your volume, being that differentiated location, being that one that stands out is going to help you grow your volume. But you also have ways inside of your practice to not lose volume and continue to grow it there. And that's where things like a automated recall process. Don't count on your staff to have to call out to a patient or manually send a letter out reminding a patient that they need to come back in, or certainly don't count on the patient to remember that they need to come back in. Find solutions that will help you automate that process where at the time of the current appointment, you can schedule that letter to go out automatically to the patient to remind them of that second appointment. And then on the chronic disease management and health assessment side, that preventative marketing strategy, having an automated process that reminds patients to come back in for their next treatment. Don't count on them. They have a lot of choices today. Don't count on them that since they started with you that they're going to continue with you. Make sure you're giving them as much information as possible to remind them to come in for that next appointment, so that way you're getting the revenue for those appointments that you're expecting to get. Another way is creating an effective front-end collection. Again, this goes very much to that patient satisfaction on the patient engagement. We need to make sure with patients, and we build a process to effectively collect money on the front end, which is not the most comfortable thing for front office staff. So first, as we talked about earlier, we need to set expectations early with patients about their responsibility, about what they're going to owe. So, so again, we're not running into the back end backlash of the surprise that occurs. But we also need to educate the staff to then utilize that data to effectively request payments at the time of the appointment. So if you do have a patient who has a high deductible plan and they have not met any of it, we need to educate the staff on what's the way to present to the patient, you're going to be incurring this cost because of the fact that you're high deductible plan, and we'd like to go ahead and collect a portion of that payment, assuming your state allows you to do that, collect a portion of that payment up front. So that way, one, you're lessening the burden on the back end. You're allowing the patient to maybe spread those payments across a couple of different payments versus all at one shot later on, hopefully improving the collection success for your practice with regards to that patient. And again, improving that satisfaction with that patient up front, making sure that you're watching out for them, you're working with them, you're managing them, and then maybe offering that automated payment plan that you've set up to allow them to make to get them set up on a payment plan, because patients do want to pay their bills, they just can't always pay it in one fell swoop. Also using cost estimation tools for key payers and services provided. So again, helping the patient to understand up front, what is this appointment going to cost them, so that way they can then have their expectations set of what they're going to end up owing. And then as I mentioned, collecting co-pays and estimates prior to the services, educating the staff to help to get them so that they can collect as much of that money up front as possible, whether it's co-pays, estimated services, deductibles, etc. And then obviously, as I mentioned, establishing those payment plans on the back end. So what are the key takeaways that we have from the webinar? A couple of them we've talked about, a couple I'm going to throw in there for you as additional ones. First one is, again, we have to embrace this patient engagement process, embrace this consumerization and patients as a consumer, but not just patients as a patient. They are shopping. They are looking for the practice that is going to best meet their needs and give them the best service possible, since they are now incurring more of the burden of the cost of their health care. So we need to embrace this and differentiate ourselves away from the other practices that patient may be looking at to get them to come to us. We need to surround our front office staff with the tools, technology, knowledge, experience to streamline that patient experience and effectively collect as much of the patient balance on the front end as we possibly can to lessen the burden on the back end. And then lastly, give them the tools so that to make sure that the front end process is enhancing the claim process and not running it, eliminating the denials on the claim process on the back end, whether that's a strong automated eligibility solution, whether it's giving the patients the ability to, giving the front office staff the ability to give that information back to the patients and educate the patients on their responsibility. All that is just going to enhance the overall revenue cycle. Again, and using preventative treatment plans as a way to grow your volume. Don't just assume patients are going to come back for their next treatment. building a preventative model, building a model where you're communicating with them, reminding them to come back in, and getting them to fill those spots, those appointment spots, such that you get that continuous revenue and the volume at the practice. And then a few that I want to throw out there just to make sure you're thinking about. Manage your provider's enrollment. As part of that patient satisfaction and that patient engagement, you don't want to be in a scenario where Sally's coming in to see Dr. Johnson and she has United Healthcare and Dr. Johnson's enrollment for United Healthcare has lapsed. And so therefore now there's some concern and question about whether or not you're the right practice for Sally, since that's her payer, or that's the payer she works with. So again, keep up on your enrollment status. Make sure you're tracking your contracts with your payers to optimize the revenue cycle, optimize the revenue for you, but also to make sure that you have the best processing of your claims going to those payers. You don't want to have patients being dissatisfied because you've run into problems with getting claims paid by the payers. And then the last one, and I throw it in on my webinars, and I'm preaching to everybody about this, but increase your visibility and preparation for ICD-10. Don't take the delay as, hey, I know I can wait till next April to worry about it. I will tell you, most organizations find that this is not a 6-month process to get ready for it. It's a year to a year and a half process. For the folks who have been working on it, they actually looked at the 6 months as a blessing to give them more time to prepare, because they were probably getting a little stressed on the timing. Make sure you talk to your vendor, your vendors that you work with, and make sure they're prepared or have a strategy for ICD-10. And if they don't have a strategy as of yet, find a vendor that does. Don't just sit back and wait for them to hopefully come back later on and come up with a strategy later on. But the key message here is don't wait till April. Start your process now. We're coming up to October 1st. Assuming that the October 1st next year date holds, you're just over a year now, about 13 months. This is the time to jump on it and get going. So before we go, again, I just wanted to give you a little bit of information about MDeverywhere. Although these webinars are not a commercial about our company, we do think it's important for you to understand why we're experts in this space and why we're knowledgeable. We are a leader in revenue cycle management. We sell a complete revenue cycle solution that includes an EMR on the front end, all the way through patient collection modules and portals and support and services on the back end. That complete solution is available to you from MDeverywhere. We serve about 7,000 physicians nationwide, over 40 specialties that we work in, so we're very familiar with all the levels of all the levels of organizations and all specialty areas. We have offices from one doc offices to larger health organizations. We don't sell you on a product. We're not selling a practice management system. We're not selling an EMR. It's part of our overall solution. Really what we're selling you on is our expertise and our knowledge that is going to translate into increased collections for your organization. We are experts at this. It's what we do. We see on average that our clients see about a 10 to 15% increase in their collections, and that's whether they come from us from doing in-house billing on their own with a practice management system, whether they've outsourced it to an outsourced vendor, if they're working with some of the other revenue cycle style vendors that are out there. Wherever they come from, we typically see that 10 to 15% increase because our folks are experts and we're really aggressive at making sure that we're getting as much out of that revenue cycle as possible and optimizing the process. And part of that is on the front end, decreasing those denials. I mentioned this earlier, making sure that the processes you have at the office, at the front office staff is equipped to be able to decrease those denials on the front end, and that's only going to help with the revenue on the back end for the practice. And then lastly, somewhat unique to us, we are an NCQA CVO certified organization. So we're not just a vendor who does credentialing but we're certified by the NCQA to do that, and one of the few organizations out there that is certified by NCQA that doesn't do the enrollment process and the CVO process on their own, where we do it for other vendors. So we can help you in a lot of different ways. If you have some interest, please let us know. Here's our contact information. You can always send us information at questions@mdeverywhere.com. Our webinars are all online at www.mdeverywhere.com/events. We have some more webinars coming up in the month of September, so please check those out. And lastly, if you want some information, you can call us at 631-232-4260. Choose option 4, and you'll be able to be connected up with someone to assist you and answer your questions. Thank you again for attending the webinar today. We hope that you found the information helpful. And again, our next webinar is coming up at the end of the month on the 27th. It is a revenue cycle best practice webinar where we actually will look at some how healthy your practice is and give you some examples of practices that, some assessments that we've done for practices and kind of what suggestions we've made to other practices based off of their financial assessment. So please, if you're interested in that, go to our events page on our websites and sign up for that webinar. We look forward to seeing you at our next webinar, and thank you again so much.